So here we have the figures. So this is late fetal life in orange. So this is 1990, and we see that here it was 4 in 1,000. Remarkably high, over 2%. I was really quite surprised, and this is for the States as a whole. Now it is coming down quite a bit, this orange line, which is late fetal life. But still, we're still looking at what, 2.7 per 1,000. So I must say it's more common than I had suspected. And the figures from the UK aren't a lot better, and I think Scotland's even a bit worse than England. So stillbirths during March 2020 to September 2021. Well, in this period of time in the States, the CDC logged 1,249,634 deliveries altogether. Stillbirths among those, the rate was 0.65%. So there was 8,154 stillbirths. So really quite that's a lot of tragedies, isn't it? 8,154. 0.65% of births. So higher, as I've said, higher than I expected that it would be. There was 21,653 deliveries to women with COVID-19 at the delivery hospital. And out of those, tragically, there was 273 stillbirths, which represents 1.26%. So we can see that if we take the total number here, so this is the total number, and then we take those with COVID-19 at the time of delivery, the risk over the whole period was greater in terms of stillbirth with patients with mothers presenting with COVID-19 at the time of delivery. So that's a definite increase over the period of time, and this is based on such large numbers. This is pretty definitive data now, really. Large numbers, pretty convincing, really. Now, 1,227,981 deliveries without COVID-19 in this period. So that's March 20 to September 21. And the overall neonatal death rate there, stillbirth rate, was 0.64%. So just a little bit. Just to remind ourselves, the overall was 0.65 when we included the COVID cases, 1.26 for the COVID cases alone, the 21,000 of them with the 273 deaths, children's deaths, stillbirths. So that takes that down to 0.64% for women without COVID, but their children without COVID. But the pre-pandemic stillbirth rate over the past few years has been 0.59. So we see that in the COVID year, stillbirths were actually a fair bit higher than in the previous year or two. And in fact, I think that's probably the average of 5 years. Now, CDC don't make an issue of this. They sort of say it's comparable, but I think they're glossing over this a bit. I think with these numbers, that would be a highly significant difference, actually. So I think tragically what has happened here is that there's been the number of stillbirths is increased during the COVID pandemic, probably partly because, remember these were mothers that deliverers without COVID at the time of delivery. This could have been partly because mothers had COVID in pregnancy and then got better. That's possible because this isn't tracking that. So, for example, this could be increased because mothers had COVID in the first trimester or the second trimester, the first 3 months or the second 3 months of pregnancy. That's possible, because I do believe that 0.64% is statistically higher than the previous year's 0.59. And the other thing it could be is, were mothers less likely to seek maternal care from professionals, which is another fairly sobering thought, that there could be more stillbirths because healthcare wasn't always accessed as frequently as it could have been.